If you've ever sat in a chair for Botox and wondered, how many units do I actually need? Well, you're not alone. In this video, I'm going to take out the guesswork of Botox. Because when it comes to results, one size does not fit all. Hey guys, I'm Dr. Carter with Modern Body Clinic, and we've used a ton of Botox already over the years. If you ever felt confused when people start talking about units of Botox, is it a foreign language or what? Don't worry, in this video, we're going to break down exactly what Botox units mean and why the number you need might be very different from someone else's. Well, it turns out the units for Botox are standardized. So when you go from one clinic to the next, the unit number is standardized and that it's going to be the same amount of Botox. When we as providers get the Botox, it's in a powder form and there's a set amount of solution that we dissolve this powder in. We mix it up, and a unit is a amount of that concentrated Botox. So you can imagine one is 1 cc, but actually it's not 1 cc, but it is some small amount of that concentration. Now, there are a few different things that go into deciding how much Botox someone needs. That includes like your facial structure, and your muscle activity, exactly what your goal is. Those are all things that go into it. Here's the thing, Botox though is not a one-size-fits-all solution. If you've ever wondered why your friend only needed a small amount of Botox and you were told you're gonna need a lot more, well, let's talk about what goes into determining what you need to get the result you're looking for. The Botox unit is a standardized amount of Botox that is injected. Now, Botox is injected into specific muscles to help reduce the movement, but also is going to help soften those fine lines and wrinkles. Common areas that Botox is used to treat include the forehead, frown lines are also called glabellar, crow's feet. These are the most common areas, though definitely there's other areas that we use it. So the distribution across the different area varies widely. What are the specific factors that go into determining how much units we're going to use? One is the muscle strength and activity. The more active the muscle is, or the stronger it is, the more units that we're going to need. Another thing is going to be age and skin elasticity. Those will affect if we need to do more or less, depending on your age and how elastic your skin is. Gender definitely is going to play a role. Men often need more Botox compared to women. And also it's going to depend on what your desired result is. If you are looking for a more subtle change as compared to a more dramatic change, you can use less or more. Let's get specific. Whether it's your forehead, crow's feet, or deep lines between your brows, the number of units is going to be much different. Okay, so let's see how this looks in real life. I'm gonna give you a range only because I don't know your specific face, your goals, or your anatomy. Now, on the forehead, the range is generally gonna be anywhere from 10 to 30 units. I will say that often 10 units is the lowest I've used unless we're doing a touch-up. Most people don't need necessarily more than 30, though I've given up to 40 units. For the brow, or the glabellar, women are generally gonna use anywhere from 9 to 15 units. Though we can go up to 20 units, no problem. Men are certainly going to often need more, anywhere from 16 to 25 is what I've seen most often. For crow's feet, again, this is something that vary a lot, anywhere from 6 to 15 units, where is a range that I'm typically giving someone. Bunny lines, and those are these little lines you get here on the nose. You're going to use anywhere from 5 to 10 units. It doesn't use a ton of Botox for those areas. Now, for the masseter, or these muscles right here on the jaw, most people are going to use 25 units, though I've used as little as 20. And this is generally to get that slimming effect of that jawline we are looking for. And then the neck, are also called the Nefertiti lips. You're going to use anywhere from 25 to 50 units. And again, it will smooth out these horizontal lines that sometimes people get. Well, you've probably heard the saying, more is better, but when it comes to Botox, that's not necessarily true. In fact, we do run the risk of over-treating the area, but also people are concerned about under-treating. One of the concerns about over-treating is that we get an unnatural appearance, or the dreaded frozen face. Now, if that happens, really, there's not much we can do other than wait for the Botox to wear off. If we under-treat and we don't give you enough, the risk is that the wrinkles and fine lines will still be visible, or we don't have a long duration of effect. One tip would be to talk to your provider and really start low and build up slowly. Because if we give you too little, we can always add, but if we give you too much, nothing to do except wait. Now, if you've ever felt awkward talking numbers with your Botox provider, don't. Know how many units you need, and being upfront about your goals is really going to be key to getting the right amount. Here's how to have that conversation with confidence. In your consultation, certainly be open about what your goals are and what you're looking to create. The provider is going to give you an estimate of how many units they think based on what your goals are and your anatomy and their experience. If you're concerned about being overtreated, communicate that and be specific about what your exact concerns are and ask if it's better to start small. In fact, here's a simple script you can use. I want a natural result. How many units do you recommend for this area, and can we start low? Well, that's the key to getting the results you want with Botox. One, stressing having an open line of communication with your provider and being clear about what your goals are. The provider is going to determine, based on our experience, marry that your goals with your muscle strength and your overall anatomy, and together you guys will come a plan that will make sense for you. But remember, Botox is not a one-size-fits-all. If you want to know a little more about skincare and anti-aging, check out one of these videos.